Dr. Ed Lin, thank you once again for coming and talk to the Fall Conference of the GOMA 2019. Tell everyone a little bit about your practice, if you don't mind.
Well, I'm a GI general surgeon at Emory and have been there for 18 years now.
Wow.
And we've got people all over the city, and I think we're impacting healthcare.
We were talking about appendicitis today, and I think the title was, Do I Need to Have My Appendix Out? And there seems to be a movement about treating appendicitis with antibiotics. But you kind of put it a little bit in perspective in your talk, so maybe you can talk about that a little bit.
Yeah, I think the definitive treatment for appendicitis is an appendectomy. But there are cases that you will have to do antibiotics first or prolonged antibiotics before you even consider surgery, and sometimes just forego surgery completely. Some of them are super high risk patients who are too sick to undergo any additional surgical treatment. And those people should get antibiotics for starters. It buys you time. It gives you time to get everybody involved to kind of take care of this person, optimize this person if you are to go for surgery. There are times that you just don't have a surgical option. You're on a trip, you're in the Himalayas, you're traveling far and there's nothing around. You don't even have a CAT scan around. You will have to treat with antibiotics, and that will buy you time again. But we shouldn't let everyone think that that's definitive therapy, because within the first year, maybe up to 25% of the patients will require some kind of appendectomy.
So they get better, but it's going to come back to haunt them.
That's right. Most of the time, you may get a success for that immediate time period for roughly 90% of the time, but by year one, that success rate may drop to about 70%.
I see. All right. Well, super. Well, once again, thank you for coming and talking to us, educating us, and sharing your knowledge.